All right. Hello, everyone. Welcome to a new episode of Weekly Hope. I'm Kirsten. It is great to be with you, and we've got a great guest for today's show. But before I introduce her, I want to tell all of you a little bit about what we do here and make you feel welcome and right at home. So as you can see, we are here on Facebook Live on the Eating Disorder Hope Facebook page. And we come on about every week, usually on Wednesdays, we're here on Thursday. 12 p.m. Eastern, and we invite guests, usually clinicians, professionals, authors, eating disorder experts, people with their own recovery stories from the eating disorder field, but also from across the spectrum of mental health to talk about different topics. And one of the really great opportunities about doing this on Facebook is that we give you the chance. So we invite guests to come on, I interview them, we chat, but we also want to give you the chance to ask your questions, to share your thoughts, and to get some really valuable information wherever you are in the recovery journey. We have a really wonderful community on this Facebook page and a really wonderful community of viewers that we're so honored to have. And I just want to say and put it out there that I just encourage you to write a comment, say hello, tell us your name, let us know where you're signing in from. One of the great things about this show as well is that we get people signing in from all over the world. And so let us know where you're signing in from, where you're joining us from today, and just dive into the conversation at any point. So that's what we do here at Weekly Hope. If you want to check out any of the resources after this program at eatingdisorderhope.com, feel free to do that. All of our partners that we have that partner with Eating Disorder Hope author all of the content, and they're all peer reviewed by experts and professionals, and often are provided by treatment centers. In fact, Montecatini out in California, Montecatini has contributed a ton of content for eatingdisorderhope.com, and so this is information that is really, really valuable, and it comes straight from experts and clinicians. So just want to encourage you that if something that we talk about today sparks your interest, you want to learn more, visit our website, and there's just thousands of articles and videos as well as former Weekly Hope episodes that you can check out as resources totally for free for you and your family. So that's who we are. Now it's time to introduce our guest. So today joining us is Sharon Zimbler. Sharon, I didn't even realize, am I saying your last name right?
Oh yes, you are. That's right.
Okay, when we talked earlier, I thought, you know what? I didn't even make sure that I was pronouncing your last name correctly. So Sharon Zimbler, and she is the CEO at Montecatini Eating Disorder Treatment Center. So Sharon, welcome.
Thank you. And thank you so much for having me here.
Absolutely. So before we dive into our conversation today, I'm going to read your bio so that everyone has a little bit of some information on your background. So is a marriage and family therapist who's worked at Montecatini Eating Disorder Treatment Center for over 10 years. And as I mentioned, she currently serves as its CEO. She has an extensive knowledge of the medical, nutritional, and psychological aspects of eating disorders. After receiving her master's degree in marriage and family therapy from Alliant International University, Sharon began working on a doctorate of psychology degree in marriage and family therapy. During her doctoral studies, she focused her research on the co-occurrence of eating disorders and substance abuse, an integral part of designing the one-of-a-kind integrated substance abuse and eating disorder program for Montecatini. So that's a little bit about Sharon's background. We are very honored to have her here. She presents nationally all over the country, so we're very glad that you took the time to be with us here today.
Thank you. Exciting to be here.
So first of all, why don't you tell us a little bit about the program at Montecatini, its distinctives, and what you do on a day-to-day basis.
Okay, sure. So, and I don't want to get too much into the background, but I think the background is really important to describe why this program became such an important part of Montecatini. So, several years ago, in treating, as a primary therapist and treating patients and seeing the co-occurrence in these patients, it became so evident that if we were not treating both of these things concurrently, there was a really, there wasn't going to be a positive outcome with either recovery from either disorder. And understanding that these two things, these two disorders work in a sense off each other. And so when one is active, one may not be active. And then when the other's active, the other may not be active. So we decided that in order to do this, and based on a lot of the research I was doing too in my doctoral program, that we needed to find a way to treat them concurrently, but do it different than just, some of the basic concepts and things that were out there. And a lot of facilities at the time weren't really doing or treating the co-occurring substance use and eating disorder. So my clinical director, Nancy Stacer, and I designed this very specific program, which helps get pretty much underneath really the drive for both disorders and giving patients the ability to speak about both things, to discuss the urges, to understand why and how those urges and feelings were coming up for each of them. So we have a specific program that we have in place at Monocattini. And we also have, of course, we access outside meetings. We also have specific sessions that will occur with therapists, group sessions, in order to help deal with specifically the co-occurring eating disorder and substance use disorder.
Awesome.
Mm-hmm.
Okay, I just wanted to make sure that you were finished and there wasn't because there was a little hiccup in the technology, so I just wanted to make sure that I wasn't getting a delay. So I'm curious, what, as someone who went in deciding, originally working as a marriage and family therapist, what made you interested at first to get into the co-occurrence of eating disorders and substance abuse?
Well, a lot of it really was what I was seeing with the people that I was working with, but also because it's something that I personally went through. So I'm in recovery from eating disorder and from substance use. And I really knew how my own battle, my own path of recovery looked. And I had a very, one of those moments in life where it was that moment that literally changed the course of my life. It could have, or it could not have. And what happened was I was coming off a relapse in substances. I was working within, a 12-step group, and my sponsor in the group just so happened to be in recovery herself from eating disorder and substance use. And for some reason in my mind, I thought, okay, well, now I'm going to be sober, completely sober, so I can start using my eating disorder behaviors, because that's the only way I can possibly get through life. I can't imagine not having anything in my life to manage all the feelings, all the stuff that happens. And so when I was kind of explaining this to her, maybe not exactly like that, she said to me, Sharon, as far as I'm concerned, if you're using your eating disorder, you're not sober. And that stopped me in my tracks. And I had to look at these things in a completely different way for the very first time, that my sobriety with alcohol and drugs was going to be contingent on my eating disorder and vice versa. And what sobriety really meant was sobriety with everything. And using, in many ways, the work I was doing in the 12 steps or whatever it was to work on all of the issues, not just focusing. It was not just about substances. It was about what was underneath. So.
Oh my God, I didn't know that your personal story was a part of that. And that's amazing. Thank you so much for sharing that. And I love how your therapist and you helped to redefine the term sobriety, because it is so often used and people think it just refers to, people outside of this field, usually just associate it with alcohol addiction. But thank you for sharing that. So we throw around the term in the field a lot, co-occurring disorders, and that term is now being used more and more, as it seems like more people are waking up to the fact that these things often occur together. But as a perspective, what exactly do co-occurring disorders, what does that term actually mean?
Well, it can mean that any disorder can occur along something else. And so for the most part, I've never personally seen a person who's had an eating disorder that does not have some sort of other diagnosis, whether it's substance use or whether it's depression, anxiety, etc. So it co-occurring can mean, co-occur with eating disorder, major depressive disorder, and vice versa, and then different iterations of all of those things. So when we talk about specifically from Monocattini, we're really focusing on the co-occurring substance use and eating disorder part. So, but it is, I think, for the eating disorder field, I think one of the great things about where we are is that a lot of things have changed. There's still so much research going on. There's so much information that we're getting to help just build the, the field and the way that we treat eating disorders. I mean, just even the awareness and this kind of thing like you're doing is revolutionary. So, I mean, as a result of that, we're really identifying more of how these things really affect one another in the recovery process.
Yeah, very cool. So why is it so important then to treat these issues together? Because when I was first seeking treatment, or I should say when my family was first seeking treatment for me, treatment was very fragmented. Between there's addiction treatment, which I know that we don't use that term very much anymore, which we're going to get to in a minute. But why is it so important to treat these issues actually together?
Well, because what happens is if you're sometimes you can't go much further in one area unless you're dealing with the other. And so specifically when it comes to any type of addictive behaviors, substance use behaviors, and eating disorder, what happens is there's a dependence, basically. Like, okay, I'm going to focus on my eating disorder. I'm going to make sure I'm doing everything I need to do. I'm going to stop using those behaviors. But in a person's mind, oftentimes the obsession starts to really become on substances. Or I know when I'm out of treatment, I'm going to be able to, even if it's just drink wine every night, or I'm going to be able to use a drug of choice, but I'll still be okay in my eating disorders. And it doesn't work that way, because basically what's happening is the underlying stuff that's driving all this is not being fully addressed or understood in how it's manifesting. And you see so many people just go from one to the other and one to the other. And unfortunately, in the world of insurance and everything too, you get people that have gone through multiple different types of treatment. They go back and forth. And then ultimately people become defeated and get hopeless and feel like I'm never going to be able to get it all. I mean, I have people that come to Monocattini all the time and think, how am I ever going to do this? I have to deal with two different things. And, we hold hope for everybody. And I think, my story is somewhat, I guess, of a testament too. And I share my story and the difficulty and a lot of the stuff I went through, but it really is just this freedom from all of the stuff that drives the urges for the behaviors, if that makes sense.
Yeah, absolutely. And you mentioned the insurance situation, and we had talked about it before that, like the word dual diagnosis used to be used a lot. And then there's the whole issue with when dealing with insurance companies about establishing a primary diagnosis and this, that, and the other. And we won't get into the weeds on that, but outside of like, how can we help people who might be experiencing several different iterations of maladaptive coping with emotional stress, very severe emotional stress, from looking at themselves as just a diagnosis, or as, oh, I'm not a substance abuser, I just have an eating disorder, or, well, I'm not an anorexic, or I'm not bulimic, I just abuse this drug of choice. How do you get the people, for example, the people who come to Monocattini to see themselves as a whole person in that process?
Yeah. Well, I think that what happens a lot is people want to, they get really stuck in a diagnosis. And the way that I look at it, the way that I treat it, that we mainly, we treat it Monocattini is understanding that, yeah, I mean, we are eating disorder primary. You can't come to Monocattini unless you have a primary eating disorder. But if we just say that we're only going to focus right now on eating disorder and not really, and ignoring the other parts of what other secondary diagnosis they may have, then we're missing a huge part of this puzzle in the recovery process for the patient. So yes, of course, there's, we have patients that are medically, that need medical treatment, need medical stability, need a lot of nutritional focus, of course, as all of our patients do. And so sometimes getting into specifics about certain things in terms of substances or other things may not be the focus all the time, but it's never put to the side. It's never something that we say, we'll focus on that later, because what will happen is then you start getting this, okay, I feel better with my eating disorder. Now I want to focus on substance abuse. And then all of a sudden the idea and understanding that all of this is intertwined together starts to become fragmented. So I don't know if that completely answered the
Yeah,
question.
no. It's so good, and I'm so glad that you're doing that great work. I just want to mention that Sarah Glover says hello from Seattle. Hey, Sarah. Carlene, as well. Shay Marie Steinmetz says, Shay from Carlsbad. Hey, Shay. She says,
Hi,
Sharon, you
Ted.
are amazing.
Aw.
Um,
Thank you. Thank
and Sonia says, hello, Kirsten. That's my new mother-in-law in Germany.
you. Aw.
So Sharon, I would like to get your clarification on, as someone who studied this, done your doctorate work on it, and is a clinician, especially for family members or parents or people who have a loved one who is struggling and they're getting to know all of this lingo and, they're trying to understand what their loved one is going through. What are the differences and similarities between an addiction and an eating disorder?
Well, I think one of the interesting things about that is that more and more research keeps coming up, helping identify where the connections and the similarities are. And so what we do know is, up to maybe 50% of people that have a substance use disorder have an eating disorder or some sort of disordered eating. That's a huge amount of people.
Yeah.
But I think what's also really, really important to know is that even if you don't have a diagnosable eating disorder, substance use disorder, you're that much more likely to get a substance use disorder simply because of the eating disorder. And that's because there are so many similarities. A lot of the similarities have to do with just personality traits, things like that, shared characteristics of maybe perfectionism, impulsivity, novelty seeking type things. And then there's also the brain and the focus on genetics. But what we do know and what we are finding is that so much of where both of these disorders come from are obviously they're in the reward center of the brain, and so much overlaps. And so just how neurotransmitters play a part in this, how different parts of the brain, dopamine plays a part in both of these disorders. So I think as we understand that piece more, it's going to really help shape the way that we can treat patients with both disorders.
Yeah, absolutely. The research is fascinating, especially with genetics and, how people are finding out more and more about how the brain works. I think if I ever went back to school, I'd want to go back for like a neurobiology or something, because I think it's just so incredibly fascinating. But I want to jump to, and also, but before I ask you my next question, I just want to let everyone know that if you've got questions at any time, please dive in and type your questions. I'm looking at the comments right now, so I'll see them and we can ask Sharon. Actually, Carolyn says, hi, Sharon, thanks so much for doing this. She says, love when the Monty family shares knowledge. Yes. Yes, we are very, very grateful for your knowledge sharing. We talked a little bit about in our phone call before we jumped on here about how when struggling with an eating disorder or a substance use disorder earlier on in life might predispose someone to suffering with another iteration of later in life. What can individuals do who are seeking treatment or maybe are in recovery right now, or even are post-recovery and aftercare? What can they do to protect themselves from that happening later in life? Is it common? First of all, is it common, and what can they do to be cautious?
Well, I mean, that's a really good question, because it does often, it is common and it can happen. And I've seen it. I think being able to have the experience, especially at Montecatini, I've been here for over 10 years and seen so many people go through the program and seeing so many people come out in recovery from both disorders, and finding and seeing people who originally said, I have no problem with substances, and then all of a sudden, calling back and that, oh my gosh, I do have problems with substances. But one of the things I think is very important is just the education around it, is really understanding the risk and understanding that by having an eating disorder, you're more at risk. And then if you add in the genetic components or just any of the biopsychosocial factors, there is an increased risk for a lot of people. The awareness too is really important. So when I have patients that have left and they're aware of it, and they may not think at the time, okay, I have a substance use disorder, and they may or may not, but they're aware that if they find themselves, or if they see themselves kind of going to or misusing any type of substance at all, including the over-the-counter stuff that we, a lot of us had used for eating disorder purposes, like laxatives, diuretics, just those types of behaviors of misusing medications can lead to something more. So it really, I think, comes down to just a lot of awareness and education on the possibilities, and being honest with yourself and having to be insightful enough to notice and admit when you're starting to struggle.
Yeah. And I think probably too, that it's okay. And I want to say this to people who might be watching this also, that it's okay to reach out for help. Like, I think especially those who struggle with perfectionism, it's like, well, I recovered from that, so I should be fine for the rest of my life. Like, that's just not how it works sometimes. Hard seasons come, and people struggle with things, and whether it's something more on the anxiety and depression end, or it's the falling into abusing a substance or something like that. Like, if you recognize that it's happening to you, like you said, be honest with yourself, don't deny it, and it's okay to reach out for help.
Yes. Yeah. And the sooner you reach out for help, the better. Because sometimes I see people that start having some issues and then they want to try to fix it themselves. They don't want to seek help. And then little by little, I always say that if you open the window just slightly to one disorder or some behaviors, you're risking the chance of the window flying open and everything coming back, all of the eating disorder behaviors, intense and substance use behaviors back. This is not something that we can just manage and say, I can control how much I'm doing. That's the illusion. And, sometimes there is a certain, with substances, there is periods of time where people can, coast along and use some behaviors, but eventually you see it catch up. They don't have to end up in complete relapse, or they don't have to end up in the situation where they need treatment, but it's more even just from how they start thinking, how they start perceiving themselves, perceiving others, the world, and the loss of honesty about who they are and what they're doing.
Yeah, absolutely. I want to Sarah has a great question. Sarah says, would you say the relationship between substance abuse and eating disorders may be why peers are being integrated into eating disorder treatment more because of the success in substance abuse disorder treatment?
So you cut out for just at the very beginning, Kristen. So
yeah. So Sarah Brownson says, would you say that the relationship between substance abuse and eating disorders may be why peer support is being integrated into eating disorder treatment more? Like, I would imagine, like AA or SA or some of those like AA programs.
Yes. Yeah. And that's a really good question. And that's a big part of it. It is, because a lot of programs, it's a difficult thing to, sometimes have a whole different focus on substance use. But first of all, I think peer support for an eating disorder alone is critical. So when you do have it, though, with somebody who has a co-occurring, I think what it does is, even if you're not focusing so much of the substance use stuff in treatment, there's still an opportunity for you to get outside support with it. So you're not necessarily having to just hold all that in, not have the opportunity to talk about it as you're going through treatment. So yeah, that is something that we've seen a lot of changes just overall in a lot of treatment centers and how they're managing substance use and eating disorders.
Yeah. Shay Marie has a great question, actually. She talks about a sobriety date. She said, I don't really like creating a sobriety date because abstinence and eating disorder is so much more complex. And saying you are not sober if using ed, would you change your sobriety date if you have a slip with an eating disorder? One drink or drug equals relapse, but I've heard one eating disorder BX, I'm not quite sure what that means, equals a slip or lapse. How does measurement of recovery relate among the two? This discourages me and needs for counting days is so focused on. That's a really good point. Really, really good point, because what counts as a relapse or not being sober in an eating disorder?
Yeah. And you cut out a little bit, Chris, but don't worry about it. I heard most of it, so I think I've got it. So yeah, that's a really good question. And I think that trips a lot of people up, because the way I look at it is that, this is my personal opinion, as somebody in recovery, is that I could not put a sobriety date on my eating disorder. That just, to me, that was not going to be effective in the way I was working in my recovery. So, because that's one thing it's different. We have to eat multiple times a day. We don't need substances to live. Like, I don't ever have to pick up a substance for the rest of my life. I don't have to drink or, use for the rest of my life, but I still have to eat every single day, multiple times a day. And so, yeah, we're going to have lapses with eating disorder behaviors. And the way that I did it in my own sobriety, in my own recovery, when I was getting sober from substances, I knew when I was using eating disorder behaviors in some ways to manage the emotions of what I was going through. And I knew, being honest with myself, when it was starting, and if it was starting to cross a line. Now, I think what comes down, and it's individual. I think, it's going to be based on what that person's really going through, and being able to say honest, like, if you know that you're having this increase of eating disorder behaviors, and it's becoming to the point where your life is really starting to feel unmanageable, and the part and substances are also becoming unmanageable. Yeah, that, to me, that means that you really need to consider looking at, okay, what am I doing here? And starting and refocusing on trying to get on a path where both of those behaviors, or even just the eating disorder, is not becoming that active. It's an individualized thing. And then people shouldn't, my recommendation is, don't get hung up in those things. Don't let those things deter you. And don't, this is your life. This is your recovery. It's not about how somebody else sees you or a date. This is about you. So don't get caught up in all of the terminology and semantics of it.
Yeah. Really, really, really wonderful advice. Thank you for clarifying on that. I think it's great. And I think it's good that as we recognize these things are very similar and people are struggling at the same time, that also the vocabulary needs to be woven together a little better, because the worlds have been separate for so long.
Right.
Andrea says, how does a nutritionist work with you? She says, give you a diet for recovering. I know you're not a nutritionist, but obviously you oversee the entire program at Montecatini. So maybe you could explain the role of the nutritionist a little bit.
Well, in terms of our eating disorder and substance use co-occurring, so just simply being dietitians, the registered dietitians we have on staff are integral. They're, of course, they're necessary for eating disorder treatment. And so they work with our patients, and they also, whatever the patient's diagnosis is. And so there is a lot of things too, that we take in consideration. And sometimes having patients that have been in long-term substance use and may have some dietary deficiencies as a result of that, the whole person is taken in consideration. So we look at the eating disorder behaviors. We look at how the behaviors have affected the person from a dietary and medical standpoint. And so because of that, we're taking into consideration what the history was like with substances, what it was like with other aspects, medical illnesses, allergies, things of that nature that would affect somebody's meal plan, because we want somebody to have a meal plan that's going to give them the nutritional needs overall for them to, restore and become healthy in that, in that point of view. So.
Absolutely cool. I just want to, Carolyn says, related to your answer about the question regarding the sobriety, I couldn't, as the first time I entered treatment, even with relapses, my mind, body, and spirit are there through the journey. And Carolyn, I couldn't count the first time I entered treatment. Yeah, that's really great, Carolyn. Thanks for sharing your insight.
Right.
Sharon, I just have a couple more questions for you. And while I pull them up, I just want to encourage anyone else to work in the last few minutes of our interview here. So if you've got a question that you want to ask Sharon, now's the time to do it. So how would you advise family members and friends who might be watching, how would you advise them to support your loved one, because it can be so unbelievably hard, so challenging. And people who are in treatment and in the recovery process, especially at the beginning, can be very much in denial or very defiant. It can be really tough. So what advice would you give for loved ones to support someone who is in treatment?
Okay. So the question I heard, there was a little static, was how do we advise families and people to support loved ones in treatment? Is that right? Okay.
Yeah.
So,
I'm so sorry about the audio. I don't know why it's being fuzzy, but
yeah, and of course it happens right, just at the time when there's the question part of it. So based on what the question of, how do people support, I think one thing is really difficult is that especially when you have a co-occurring substance use and eating disorder, there's a lot of denial on either side. And sometimes people are willing to say, okay, I'm willing to work on my eating disorder, but I'm not going to deal with my substances. Whatever gets people into the door of a treatment center, a therapist, a dietitian, psychiatrist, whatever it is important, is being able to take a first step. Because sometimes that window of I'm willing is not going to last long. And if you don't act in that moment, the willingness is likely going to go away. So the eating disorder substances are very strong in saying, you don't have a problem, you're fine, you can take care of this. A lot of times what families have to do is they often have to seek their own help, their own support from outside help, therapists, support groups, in order to figure out how to help their loved one. Because, a lot of times you see people who are trying to control the situation, which a lot of times is what needs to happen. But the whole process can be so difficult. And having somebody sometimes to be able to guide you through that can be really helpful. And one thing is that, sometimes we see that the external motivation that families, loved ones put onto people is what gets them in the door and helps them stay there. And so what I mean by that is, it's not really that common to see people with strong internal motivation coming to residential treatment saying, occasionally we see some of that, but it's oftentimes more on the, I don't want to do this, but I know I have to for X, Y, or Z reason, so I'm here. When we see families have that external motivation, whether it's drawing a boundary and saying, we are not going to continue to support you or help unless you seek the proper treatment, that has made the difference of people recovering and not recovering. And one thing too is really being able to work within the treatment team, if they're in a treatment center or with outside help, to figure out how to support, because it's a difficult emotional road for families.
Yeah.
So
wonderful. Thank you so much. And then last question is, if someone is in recovery right now and they are experiencing some hopelessness and feeling like I'm never going to get through this, what encouragement would you give them?
Remember, this is one thought, one moment. Yeah, maybe it's going to last a few days, maybe it's going to last a week, but we can't tell. We don't know what's ahead. We don't know what the possibilities are. What we do know and what we do have control over is how we perceive the events and what's going on in the moment. That's it. And so if we assign this idea that I don't have hope, it's never going to work, then it's likely not going to work. It's going to be hard. Yeah, we challenge those things. We acknowledge that we're feeling hopeless. We're feeling like something is hard, but at least try to stay open to the perspective of, I don't know what's going to happen in the future. And there are people who have recovered from both disorders or from an eating disorder. And a lot of times people say, but I can't imagine what it was like, are you in that situation? And I think my situation's worse. That's the thing. If it really got down to it, and a lot of people that have been or in the other side of recovery, when we tell our stories, people are like, oh my gosh, that's amazing. Just remember that other people are walking through this too, and get help and talk about what you're going through.
So good. Sharon, thank you so much. Thank you for your insight, your wisdom, and for taking the time to share all of that with us and with our viewers. We so appreciate it. And thank you for sharing your recovery story. And I'm just so glad that you have been able to use all that to do. I mean, to do what you're doing now and save lives. It's amazing. Thank you.
Yeah, thank you. Thank you so much for having me. And it's amazing when, I see sometimes my life has come full circle and where I was, where I am now. And it's an incredible thing to take in and to be able to share with other people that are going through the same thing. So thank you.
All right, everyone, that is our episode for today. I hope that you learned something and were encouraged no matter where you might be on your journey. And I just want to encourage you as well that if this is something that you think someone else might need to hear, a loved one or a friend, or again, it will be here on our page, on our Facebook page, as well as to our YouTube channel, our YouTube channel here in a few days. So, we'll see you back next week for another episode of Weekly Hope. Stay tuned to our social media for that date and time and guest, but we will look forward to seeing you again next week. All right, where we are, and we'll talk to you very soon. See you next week.